Hey, I'm Dr. Chris. Welcome to my YouTube video channel. Today we're going to talk about why or what tells you that you need to go to see a chiropractor.
You've got to get this. It's fantastic.
This is the real deal. I'm blown away by this. I can't believe it.
I've always thought of myself as a wellness doctor, but more than anything, I think I'm a pain doctor.
Over 7,000 patients.
Learned a lot.
Yeah. Okay. Athletes, performers, dancers. These are people that need their bodies to do incredible things.
Absolutely, of all ages too. I became a chiropractor, most think, because I grew up in a chiropractic family. My dad was a chiropractor.
So I've been a chiropractic doctor for 33 years. I'm a second generation chiropractor, and I run the Center for Fitness, Health, and Performance in Toronto, Canada. I've got a team of 30 working for me, and this is what we tell everybody. If you've got a spine, at some point, we'd suggest that you have a checkup so that you learn about your spine and its spinal muscles so that you understand where your weaknesses are. What do you look for and what reasons do you have behind going to a chiropractor? There was a book written by Dr. John Sarno, a medical doctor, and he talked about and validated that anxiety, frustration, and depression are always associated with back pain. Now, I've been in practice for 33 years and I've seen 20,000 patients, and I will tell you that's not always the case because people do have injuries. People do get hit by a car. People do fall off a bike. There is a tie, and chiropractors have been saying this forever. The nervous system is filled with emotion. So the more emotional stress we have, whether it's anxiety, frustration, depression, this will create way more tension, way more excitability in our muscles and our nerves, and it will always hone in or focus on our areas of weakness. It doesn't typically create problems, but it accentuates our weaknesses, and I think that's what John missed in his book. But again, you can be anxious, and over time you will get physical pain, or you can have physical pain that creates anxiety, but the two go hand in hand. And if you're feeling that way and you want to break that cycle, I think that a chiropractor is a good place to start. The earlier you do this, the easier it is for you to fix those weaknesses through stretching, exercises, different postures. Sometimes a leg length difference is accounted for, so we put a little heel lift in, orthotics, all of these different things, some adjustments, again, a deep massage, lots of things or reasons that we can account for that say, look, just get a checkup and learn about who you are, because everybody's different. And this is what you want to figure out sooner than later. If you haven't done that and you hurt yourself, the funniest thing that you need to understand is this. Your nervous system is like a fantastically adapting machine. So if you hurt yourself and the pain goes away, because let me tell you, in most back pain cases, 80% of the time, the pain is gone in 6 weeks. That's what the literature says. However, once you've had back pain once, you've got an 86% chance of having it again. Right now, back pain is the number one global disability in our society, and neck pain and shoulder pain with headache combined is number 4. So it's not something we should take lightly, and we should really start to understand it. So pain is always to be considered an alarm that you don't just hit the snooze button on. You actually listen to it. You try to do some stretches on your own. You might use some MUSCLECARE topical pain reliever that we developed, or, you might go to see your massage therapist first. But you know what? Here's the deal. If you feel something sharp and it's impeded your ability to get up and move, I would strongly encourage you to go right to your chiropractor or find a chiropractor, get an assessment, a proper assessment, not just an adjustment, an assessment first. And then potentially some x-rays to determine if there's something else wrong in there. Maybe you've got a lot of degeneration or wearing in the back from doing bad things. And you know what? Bad things can be as easy as this. You sat in a chair for 25 years working. You know what? You compress the discs of the lower back. The joints are very close. The nerve roots are being compromised or irritated as they come out of the spine. And that's enough to say, hey, I need to go to my chiropractor. The disc, once it's flattened, again, isn't a life sentence or isn't permanent. Because a lot of these x-rays that show, or CAT scans or MRIs that show the disc flattening or bulging, it's a function of muscle imbalances. And if a muscle's pulling on one side, then we see a wedging of the spine the other way. So it's really important that you think this through and you look at ways to improve the muscular balances around the pelvis, the hips, the back, the spine, the neck, etc. So again, any alarm is not to be snooze buttoned. Acknowledge it, stretch it, ice it, MUSCLECARE, try anything. Preferably not medications, because this is where in the literature we are not pushing people to use medicines right away. The American College of Physicians and Surgeons in November of 2020 set a new guideline, said that anyone who presents with an acute pain, and that means within 1 to 7 days onset, They cannot and should not be given an opioid medication or a non-steroidal ingestible. So that means that if you take something inside, it has a side effect. And it also has the propensity to become something that people get addicted to. And North America is the #1 society for the addiction of opioid medication. And the doctors know this. They've got to start to try changing that picture. Try your best to use a topical steroid rub or a MUSCLECARE rub first. Call your doctor, call your chiropractor, take action and learn. The thing is that the difference between a medical doctor and a chiropractor is that a good chiropractic assessment will be a top to bottom biomechanical assessment, and they'll be able to tell you so much about how muscles, joints, discs, nerves work together. You typically don't get that from your medical doctor, and it's not that I'm putting them down. I'm just saying, you know what? We work together with the medical doctors and medical system, but again, to get the right diagnosis, I would go to my chiropractor first. Use pain as an alarm. Don't just push it to the side. Take action and minimize those flares, because once they start to flare up, the other things we see in business and in practice is that once the flare-ups start, they become more frequent and more intense and more debilitating. That's the way a back works. And I'll tell you, the reason, if you're not understanding it, is that our bodies have a weakness, and that starts to give us little alarms. And if we act on it, we fix that weakness, we're great. But if we leave it, we compensate somewhere else. And then we compensate somewhere else. Until that area fatigues, we compensate somewhere else. And all we do is create more and more problems in our spine so that we are more and more prone to mechanical wear and tear and degeneration, arthritic changes, or osteoarthritis. And that is bad. We don't need to do that. Let's be a smarter society. Let's take action and don't hit pause on your pain. Have a great day. And go see your chiropractor.